Hey everybody, I'm Target 12 investigator Tim White, and I am joined by my colleague from Target 12, Eli Sherman. Hi, Eli, how are you?
Hey Tim, doing well.
So, Eli, we've been getting a lot of questions into the 12 response system about nursing homes, which is, you can understand that because the majority of the cases that we hear about, the daily briefing from the governor, well, I should say the majority of deaths that we hear about are at nursing homes. But people are hungry for more information about that. And I have a question here from Al. And Al wanted to know what is the total current number of confirmed COVID 19 cases in Rhode Island nursing homes versus the total current population of the homes. And this is information that wasn't just out there. You reached out to the Department of Health to get this data. What did you find?
Yeah, so there's is a little bit of a lag in the numbers, so I don't think that this is quite a total count. But for what we know right now, snapshot is that there are about 615 cases across nursing homes throughout the state. And if we take that number and compare it to a best count from 2017, a number that was from the Kaiser Family Foundation, a national nonprofit that counts this type of stuff, the nursing home resident population during that time was about 7,800 residents. So taking the 615 cases compared to the 7,800 residents, that's about 8% of people in nursing homes right now have tested positive.
That is not an insignificant number. Now, you got a breakdown of the nursing homes in Rhode Island. I'm going to put it on the screen right now. You put together this chart based on the data that you got from the Department of Health. And as folks at home can see, you have the nursing homes in their location on the left, the cases among patients or residents at those nursing homes, and then you also put in there staff. And then the final column is deaths. Eli, when you look at this and through your reporting, what stood out to you?
It's pretty astounding, just considering how much of an impact this disease is having on nursing homes in Rhode Island. You know, it's interesting, Tim. This isn't unusual for states throughout the country. A lot of places are grappling with the disease hitting nursing homes particularly bad because they're congregate care settings. It's people who are living close together to one another, and a lot of the people who are moving from room to room, the people that they interact with each day, are nurses and RNs and people who are going from room to room and have there's the possibility of spread happening that way. What's particularly interesting about Rhode Island is that the deaths make up a higher percentage of the overall deaths happening in Rhode Island. So you could look at that a couple different ways. One is, okay, the state perhaps or people in Rhode Island are doing a better job at protecting the overall population. Or you could look at it and say, well, are we doing enough to protect the most susceptible population from the disease? It's an interesting thing that's happening in Rhode Island.
And I look at the data, and I think when the dust settles, uh, it's going to be an examination of how each nursing home handled the situation. And let's just look at Summit Commons here. And I should tell people at home, you and I are talking now on it's Wednesday, right? We lose track of time. But we're talking on Wednesday, April 22nd. And you might be watching this video on a different day. So these numbers are going to change. We're going to update them on our website when we can on WPRI.com. For those of you who are watching this on another platform like YouTube, which we hear a lot about, go to WPRI.com so you can see these numbers posted right below this video. Okay, so what I was getting to was you look at Summit Commons, 70 cases that you have there, fewer than 5 staff, and then fewer than 5 deaths. That's, one death is terrible, but that, relatively speaking, is good news. When you go up to Oak Hill, has about the same number of cases, 18 deaths, 85 cases at Golden Crest, 27 deaths. So I think it'll be, again, as they go back and look at nursing home by nursing home, what were the different factors, and there's so many: age, health of the residents, the layout of the home that caused the disparity between cases and deaths. That has to be on the table for the Department of Health, I'm sure, again, months down the road.
Yeah, one thing I'm watching real close to, Tim, is that people will remember that Golden Crest, Oak Hill, Orchard View, where we're seeing the highest concentrations of deaths was those were the three locations too where the disease first popped up. So it does make me wonder too, okay, in some of these other homes where now we're seeing cases beginning to rise among patients, are we going to see subsequent deaths after that? Which is,
Yeah.
a hard thing to think about.
Yeah.
But when you think about the disease as a wave, are these other institutions doing a better job at protecting their patients, or are they just further behind from Golden Crest and Oak Hill? It'll be,
Let's take another question if we could, Eli. Final one here. This one from Nance. And she writes, how come the governor or the medical director, and I assume Nance is referring to Director Nicole Alexander Scott from the Department of Health, are not confirming the nursing home cases of COVID anymore? My dad's 93 in a nursing home. So the numbers that we just had on the screen, Target 12 assembled. What is your understanding of how the state is going to release this data moving forward? Can we expect that as part of their regular updates now after you've asked about it?
Yeah, health officials have told me just yesterday that they're in the process of trying to make this information more accessible. Like you said, Tim, I get emails all the time from people asking for more specific information. A lot of people have loved ones in nursing homes, and obviously for more than a month now, they haven't even been able to see them in person because they've shut off visitors from visiting. So any and all information that they can get right now is brings some level of comfort, and the health department is telling me that they're going to be trying to make this information more readily and speedily available.
All right. We'll keep an eye out for that one. Eli Sherman, thank you for your hard work on this. This is obviously high interest to a lot of people. And again, for up-to-date information on the data we were just talking about, make sure you look below this video on WPRI.com for the latest information.